Hey everybody, Dr. Parker Mitchell here. Welcome back to another episode of The Office. In today's video, I want to go over everything you should know about getting a dental implant, all the bad things, all the good things, and then also how your dentist should be placing an implant. I'm going to walk you through a case from start to finish so that you have a better understanding on exactly how this process works. We're going to jump over to my computer so I can sit down and explain things a little bit better, and also work on this case together so that you can get a really in-depth understanding on how this process works. So here I have a 3D printed model of DT's teeth. As you saw earlier, here is his 3D printed surgical guide, which will then fit over his teeth like this. And then what's really cool about this special set of drills that I use is that they're designed for this surgical guide so that they only go in here the perfect angle, depth, and direction, exactly like we planned it. Now, the number one question I get asked about dental implants is, does this hurt? And in fact, the worst part about this is actually the extraction itself. The implants don't hurt that much because all we have to do is numb the gum. You don't have nerve endings inside of your bone. It's only the gum tissue. So we just barely make a small hole in your gum after numbing it and then place the implants. About a 10-minute procedure when it's fully guided like this. Then it has to heal for 2 to 6 months before getting a crown on it. And that's it. All right, so if you've lost a tooth, there's really 4 different options you have to replace this tooth. And I'm gonna go in order from the cheapest to the most expensive and best option for replacing your missing tooth. We're gonna start off with doing absolutely nothing. You do not have to replace your tooth. Now, obviously, if it's up front in modern society, replacing an upper tooth or a front tooth is really, really important because of aesthetics, and you don't want to be judged by people for not having a front tooth and also losing ability to eat. But let's be honest, it's not going to kill you, okay? You can live without a tooth for the rest of your life if you absolutely have to and you cannot afford it, especially if it's all the way in the back of your mouth. I personally do not recommend my patients to replace a second molar. You have 3 molars on each corner of your mouth, and the thirds are your wisdom teeth. Those I do recommend to have removed because they can cause problems down the line. But if you lose a second molar due to a cavity, an infection, an injury, replacing it is not always the best thing to do. And the reason being is that it's very difficult as you get older to clean around that implant. And implants require the utmost care and attention to when you're cleaning your teeth. So I tell my patients after extracting a second molar, I say, you don't have to replace this tooth. In fact, I don't recommend it. However, after we take it out, if you truly miss it, then we can replace it with an implant. Since it's a second molar and your wisdom teeth are most likely not in place, doing a bridge like this is not an option. And the reason being is a bridge requires to be seated on the teeth either side of the missing space in the middle. And yes, I'm using my head as the empty space here. So let's jump into the next option. We have a partial denture. This is a removable piece. It is the most affordable option for replacing the tooth, and it's also the quickest option. But you're gonna have this giant chunk of piece of plastic in your mouth that you're not used to, and I'm gonna tell you right off the bat, you're gonna absolutely hate it. With that being said, I have seen patients that have had partial dentures for a very long time and they've become accustomed to them. But for somebody who's new to something like this, you're probably not going to like it. It's going to take a lot of adjustments and it's not going to look the way you want it to. Moving on to option number 3, as discussed earlier, is a dental bridge. A dental bridge looks something like this. And in order to replace the missing tooth in the middle, you will have to grind down the teeth on either side. Now, there can be pros and cons to this. The pros being you can gain aesthetics. You can make the teeth, all 3 of them, look really pretty. You could get rid of cavities on the adjacent teeth. You could get rid of cracks, old fillings. You can change the color and even whiten before you get a bridge. But you're having to grind down sometimes teeth that are completely healthy. And that's the only downside of doing a bridge. They work great, they're glued into place, and they're supposed to never come out and have a lifespan of 15 to 20 years. And I've even seen them last 30 plus years with the modern dental tools and materials that we've been using. Now let's move on to my favorite option, and my favorite option is obviously going to be a dental implant. A dental implant essentially acts as a post that you screw a tooth into. What's really cool about a dental implant is that you do not have to mess with the adjacent teeth. The only issue is you have to wait. Implants take anywhere from 2 to 6 months. Usually how the process goes is you extract the tooth, you place a bone graft. You can either place an implant at the exact same time, or you can wait a couple months and allow that bone to heal and place an implant. Now, me personally, I get better results when I wait and allow that bone to heal. And the reason being is that I use the analogy of pulling a tree out of the ground. If you pull a tree out of the ground, you have a large hole there. If you fill that with topsoil, you can get settling of the bone or the dirt. You wouldn't want to build a house on it right away. And that's why I see large commercial spaces before they put up a huge complex is they'll put a ton of fill dirt on top of the site, allow that soil to compact, and then start to build it up. That's my thought. All right. Everybody does things a little bit differently. I know in other countries, they're very gung-ho about placing implants and placing teeth on the implant at the exact same time. I just think you get a better result when you wait, and that's my personal opinion. And your dentist may have their own opinion as well. But there is one thing I want to talk to you about in this video that is very, very important when it comes to placing implants. There's so many dentists out there that place dental implants in what we call free-handed. Free-handed meaning not using a surgical guide. Okay, and that's the whole point of this video, is to walk you through why a surgical guide is going to be the most important thing for placing a dental implant. Imagine you have a brand new Samsung 86-inch television you want to hang on the center of your living room wall for Super Bowl, and all your friends are coming over, and you're looking at this wall and you're thinking, I got this, I can hang it up. And you hang it up and that sucker is crooked. And then you got to take it back off, and you got to drill new holes, and you got to hang it up again. It's kind of like placing a dental implant. These dentists will go in completely unguided and just eyeball it. They'll eyeball where they think the implant should go based off of a two-dimensional x-ray, and it can be catastrophic to the implant in the long run, because the implant could be placed too far towards the tongue, too far towards the cheek, too far towards an adjacent tooth, and create a tilt or angle on the implant that when you put a crown on it like this, when you chew on it, it could then break or cause the implant to fail. So with that being said, I would like to walk you through why I plan implants and how I do this so that you have a better understanding of the implant process. Now, I do want to stop this video right here and say that if there's anybody out there that has questions about dental implants, leave them in the comments below or shoot me an email. I'll put it in the description below, where you can get in touch with me or my office so that I can answer your questions and help you through this missing tooth process, because I know it can be super confusing. Let's get to planning an implant for one of my favorite patients that's missing a tooth right here. All right, Chad, and as you can see, Mr. DT here has all of his upper teeth, but he is missing a first premolar here in the upper right. Now, like we talked about, we could do the bridge option where we would smooth down the tooth here, we would smooth down the tooth here, and then we could bridge this gap that is glued into place, and it would make all these three teeth look nice and even. You could get rid of this root showing here, but this patient doesn't have anything wrong with these two teeth. They're completely healthy, and in fact, it looks like he might already even have a bridge up here. So with that being said, this patient has opted for a dental implant, which I've discussed earlier is the best option you can do for a space like this. So what we're going to do is we're going to start off by simulating a fake tooth in this area. And the reason why this is important is because we're going to essentially reverse engineer where this tooth is going to go. And what's really cool about this is that way the implant doesn't end up too far towards one direction, too far towards the lip or the cheek or the palate, or it's not tilted one way or the other. And so basically this looks really good. You know, we might bulk it out a little bit like this, and this doesn't matter exactly right now on shape and size and everything like that. It's more or less to kind of get the general size and direction of where this tooth is going to be going. So as you can see, we've got a simulated number 5, or if you're international, this would be a 14. This is a first premolar in the right maxilla if you want to get technical. Oh, look at that. He's even got an implant already up front. So what we're going to do next is we're going to move on to placing the implant in the perfect position for this tooth that we just put in place. So I've got a 3D scan of his jaw, which is called a CT, but I've also got a 3D scan of his teeth. So once I combine these two together, I can then simulate where I want this implant to go. And what's really cool about this software is it allows me to place implants directly into the bone, outlining and showing this tooth on where I put it. And I have a library of all of my implants and the inventory in my building. So what I'll do is I'll put an implant in like this, and I can correct for the angle. I can make sure that it's going straight out the bottom of this tooth here. I can then rotate it around and make sure we're not too close to the implant that's behind it or too close to the tooth that's in front of it. And looking at this yellow line here is the outline of the implant, and then this white border here is a safety border. So since we're infringing upon this implant within our safety parameters, I'm going to go ahead and narrow this implant to a 3.8 millimeter implant, but he also has a ton of bone up here, so I'm going to go ahead and make this implant longer. So when I go through this, I think this implant's going to be really nice. Yes, it's going to be deeper. It's also going to be longer than the implant next to it, but that's okay. I'm going to use that healthy bone that he has from when I extracted this tooth. And as you can see, we're far away. We're outside of our safety parameters with the tooth next to it and also the implant next to it. And we're right in the middle of this entire jawbone here. But what I really want to show you is this view here. This is really cool. When you take a look at this view, what I'm looking for is this, where is this pink line falling? Because this is where the tooth is going to get screwed into the implant. We want, when he's chewing, to go straight up and down onto this tooth. If this pink line was too far angled one direction, what we talked about earlier, it could put forces on that implant which could cause that crown or that abutment to break. I really like this. In fact, I actually want it to be a little bit more towards the tongue side. So what I'm going to do is I'm going to tilt this implant more towards the tongue side like this. And as you can see, it's even pointing right at his bottom tooth right here. This looks like a and I'm even a little bit too close to that tooth in front of us. So I'm going to move it back just a smidge here. We're going to go all the way around, make sure we're within our safety parameters. Beautiful. Let's go back to the view here. Oh, that's a perfect. You know what? I'm actually, see how it's not centered. Do you see this? It's almost tilted a little bit towards the back of the mouth. So I'm going to fix that. I'm going to go like this, and I'm going to tilt it just a little bit more like that. That looks really, really good. This looks like an implant that would last this patient a long time. It's almost too far towards the palate, so I'm just going to tweak it a little bit more, maybe something like this. And this looks good right here. So we're going to go through making what's called a surgical guide. And what this is going to allow me to do is I'm going to place this over the patient's teeth during the surgery, and I have a special set of drills I'm going to show you shortly on that only fit into this guide. Alright, so right now what I'm doing is I'm outlining where I want this piece that I'm going to 3D print in the office to snap onto his teeth. I like to go from 2 teeth backwards to the other side of the canine, and you're going to see why this outline is important here in just a moment. But what this program is going to do is it's going to make a piece that I can 3D print in my office that will sit over his teeth with the perfect hole for my drills that I'm going to show you here shortly, so that this goes exactly where we want it. And I'm going to go ahead and put his name on here too so that it doesn't get lost in the mix. DT being his initials, and then the number 5 being the tooth that we're going to replace. So basically what I do here is the program runs its course, and now I have this piece, which is my surgical guide, that looks something like this with a hole in it, and these special drills only go into that hole exactly how it should. It doesn't go in at a weird angle, it doesn't go in too deep. It puts that implant exactly where I planned it, so that when a crown does go on this implant, it's going to last this patient the rest of their life. And that's why doing surgical guides like this is so important. So now that we've done this, let's go over to the 3D printer and print this out so you guys can see what that looks like. And then I'll bring it over to the drill set so that you can understand how this is going to go in and out of the patient's mouth. All right, so as you can see, Mr. DT's surgical guide takes 43 minutes to 3D print. I'm also going to print a model so that I can show you how it fits on top of there, and then we can kind of play around with the drilling sequence for you guys. But pretty cool, this can all be done in office. I've got 3 3D printers, 2 of them are for teeth. That's my fun one. Pretty sick setup, I'm proud of. All right, well, the print just finished up. I'm going to show you what this looks like. There it is, up on those little pegs. So we'll cut all those off, and then I'm going to get this over into our wash machine like this. Start it, it'll clean it all up. We'll put it in a light cure, and then I'll show you how it fits on the model. So here I have a 3D printed model of DT's teeth. As you saw earlier, here is his 3D printed surgical guide, which will then fit over his teeth like this. And then what's really cool about this special set of drills that I use is that they're designed for this surgical guide so that they only go in here the perfect angle, depth, and direction, exactly like we planned it. Now, the number one question I get asked about dental implants is, does this hurt? And in fact, the worst part about this is actually the extraction itself. The implants don't hurt that much because all we have to do is numb the gum. You don't have nerve endings inside of your bone. It's only the gum tissue. So we just barely make a small hole in your gum after numbing it, and then place the implants. About a 10-minute procedure when it's fully guided like this. Then it has to heal for 2 to 6 months before getting a crown on it. And that's it about dental implants. Like I said earlier in the video, if you guys have questions, just drop them in the comments, send me an email, and we'll see you on the next video.